Hi guys, welcome back to Codemaster Coach, your medical coding tutor. Today is my final video working with Ms. Jasmine Vialas of Integrated Practice Solutions. And her question for me today was, what should an organization look for when hiring a medical coder? So stay tuned as I answer that question. And guys, below in the description box, I have left a link to her channel right here on YouTube. Okay, guys, see you in the next one.
Okay, so how would a medical provider or organization know if they should hire a medical coder? At what point in their practice and at what point in the organization does it become a necessity, and is it only specialty specific? How would they decide that they need to get a medical coder on staff, someone who's certified?
Okay, certification. Okay, now you're getting a little more, because I was going to say, in order to generate a claim, you have to have a code. So you're going to need a coder, whether it be a biller and a coder in one, or I hear a lot of physicians, their spouses or their office manager who does it all. Either way it goes, they're going to need somebody to code. But I think when you said certified, I think industry now, we're taught now as far as industry, you're not a coder unless you're a certified coder. Because healthcare across the board, I think today, is looking for certified coders. Now, which certification is going to depend on the individual. I recommend starting with the AAPC's CPC certification, because that's the entry-level certification. Now, AHIMA has certifications and AAPC, and this is how I always give my story. I always say, it was always AHIMA. AHIMA is the mothership. But AHIMA got so big and has gotten so broad as far as not just medical records, not just transcription, which is now voice generated, not just release of information, but AHIMA has gotten more into the politics of healthcare with the electronic medical records, that the coders pulled together and started their own association, which is now the American Academy of Professional Coders. So we started with AHIMA, American Health Information Management Association. And then when the coders pulled off and started their own, AHIMA still educates coders, but AAPC, the American Academy of Professional Coders, their primary emphasis is on coding, medical coding.
I love that breakdown.
Yeah, whether it's a specialty or so I always recommend to my subscribers to start with the AAPC's CPC exam. One, it does not require any kind of college education. It does require training, because that CPC exam to me was not an easy exam. I found it kind of hard.
Right.
They do have like these 7-week or 17 weeks. It's not a really long course, but again, AAPC's training, which is like, I think it's 7 weeks long, are for people that are in healthcare that want to get certified in coding. So they've got some experience and they can do a 7-week training.
Right.
Now, someone off the street, it would be a little more difficult for them to just sit in 7 weeks of training and pass the CPC exam. And that's why we hear over and over people that don't pass the exam on their first try, because they haven't had
Foundation.
even their foot, right. They haven't even had their foot in the door to even understand what coding is. But I'd recommend you start with that CPC certification through AHIMA, AAPC, and then grow. There's a CCA exam, there's a CCS exam, so you can grow from there. But the rule of thumb now is, if you're not certified, you're not a medical coder.
And so let's talk about that, the certification part. Why is it important for the medical coder to be certified? Because I hear this a lot, where someone like you mentioned, someone has these dual functions in a practice or an organization, and they are double as office manager, practice manager, and the coder, and maybe the billing manager and all these different hats that they're wearing, but they've never been certified as a coder, yet they're entrusted with this very vital part of the medical, the billing creation process, and an extension almost of the provider themselves as a medical coder. Why isn't a certification important?
The goal of certification is to prove your knowledge. In other words, just because you don't have certification, I have met some dynamite coders. I mean, I think I got my first training from a lady that had done coding for years and wasn't even certified. She was an RN by training who had come off the floor as hands-on patient care into a medical record department and had done coding for so many years. She could teach me some things that I couldn't find in a book.
Mm-hmm.
It's just from experience. So I'm not knocking coders that have experience and have been coding for years.
Mm-hmm.
I just wish those coders would go back and get certification to back their experience.
Mm-hmm.
Because now with industry saying you have to be certified to be a coder, it's kind of hard because a lot of times those that have been doing it for years have been working for the same organization for years. They know that position, they know that position's work, and they can code it like the back of their hands. But put them in another industry or another setting, and they kind of lost.
Right.
So with certification, you're able to prove yourself because certification doesn't focus in on just one specialty.
Mm-hmm.
My students used to always tell me, Codemaster Coach, coding is hard. And I'll say, is it going to be like that in the real world? And my answer is, in the real world, you tend to go into specialty coding. So right now in a CPT book, you might just be doing OBGYN coding.
Mm-hmm. Mm-hmm.
But in class, I have to teach you path lab, E&M, anesthesia. I have to go through every one of those areas. You have to learn all of those areas for certification.
Right.
But when you get out there, you're only going to focus on one specialty. So it's up to you to stay current and stay studied up. Even though you're only working for your OBGYN, you're not using your path and lab or your other areas of surgery codes, radiation or radiology. Even though you're not using that section of your CPT book, stay current. You don't know if you're going to leave that office, what else you might do.
Mm-hmm. Right. You want to grow into something else.
Right. But yeah, certification is the big thing now coming out. You need to be certified.
Very good. So tell me a little bit about what you said the industry standard is, or if the industry requirement is for certification. Why do you think they are requiring the certification, and why does that benefit the practice organization?
A prime example is, like I told you, the lady that I trained under when I first got into healthcare or health information management. Because she knew the shortcuts as far as that facility, she could teach them to me.
Mm-hmm.
But if I were to put her in another setting, she couldn't. With certification, I always have students saying, which certification should I go for? Which is right? Start with entry and you'll figure out which one is the next one that you should go for, because there are multiple ones out there.
Right.
But, and you asked me, you asked me to focus in on something on that question.
So why is it that the industry is requiring certification? What is it that might benefit the organization or the provider themselves to have them be certified? Is it there for a layer of protection, or what's the purpose behind the industry requiring certification now?
And the weird thing is, they don't recommend which certifications. What I'm finding is that, for example, someone like me coming in, already certified, working, if I go to hire somebody, I know which certification they should have. But a lot of physicians will just, or even practices will just say, just be certified. They don't know whether it's a CPC, CCA, CCS, RHIT, or RHIA. Just be certified, which just means just have some kind of training or certification under your belt that proves you're competent. Because on certification, your competence. You get someone that's been in it for years that's not certified, they know their facility, but they're not current on the new guidelines, and they know just enough to get by. So I think that's where certification comes in, why it's so vital. As far as credentialing, I guess the legal standpoint for organizations, I haven't heard yet of any laws that state that your coder has to be certified. But I do know that industry wants certified coders. It just proves your competency.
Right. Third party that's objectively decided that you are able to fulfill the function of coding, right? I think that that's what they're asking of the organizations, just to not have to worry that they're bringing on someone who perhaps is missing these important pieces. If AAPC has kind of confirmed, certified them as they know how to do coding, then it really can alleviate the stress of them not being kind of, I don't know if the best word is blamed, but if the person is not able to fulfill the proper functions, then they're relying on, well, we hired them because they were a certified coder. And obviously, you know, we were under the impression they had kind of that basic competence to fulfill those functions. So it, I would say, might be a way for them to not be blamed if there was a problem with the coding. I don't know. Would you agree?
I think ultimately still the organization would be the ones that get sued, not the coder.
Exactly. Not the coder or the coding organization like AAP.
Right.
Yep. Yep. So they have to still take responsibility for what their coder is doing, which is really important. I think a lot of organizations trust too much in the manpower without verifying what's happening in the organization. So you can always, necessary in all of, you know, both coding and the billing side, all of the revenue cycle has to have an audit process around it so that it protects all parties. So everyone knows that, you know, if you've got 5 coders on your team, we need to know that everybody is following the same protocol and has the same kind of level of knowledge and awareness of what is to be done and when it needs to go back to a provider for additional information. If a report doesn't have any enough detail to complete a note, we don't want assumptions made and all that. That's always where people get into hot water.
Right, but then it still ultimately falls back on that organization that hires that coder, because I always tell my coders, when you interview for a job, be prepared to be tested. Right. Take your own code books, because it's hard to go onto their software and their system and take a test at your interview.
Right.
Take a test you bring your own resources, bring your own code books, your medical dictionary or whatever, and be prepared for a test. Even though you've got your certification, when you go and interview, hopefully they'll have at least 10 questions for you to code that pertain to what their specialty is, so that you can, in addition to certification, prove yourself.
Mm-hmm, mm-hmm. That's great advice, right? Because knowing that you have the certification, but perhaps they want to see your knowledge put to the test with their scenarios. So they, you know,
right,
rearrange some patient information and give you a scenario of exactly what their organization or practice deals with on a daily basis. They want to know that you'll be successful with the organization, because coding, you know, it's an investment for any organization or practice and a coder. And so it would be important to know that they're not going to have to reveal or uncover, you know, the inadequacies weeks and months down the line.
Especially because the organization is ultimately going to be responsible that hired the coder. It's going to be ultimately responsible.
Mm-hmm. That's a really good point, actually. Making sure that there's a proper process in place to evaluate your coder before you put them in place. And, you know, I say this too, just on the topic of the wife topic, or the person who's worked with them forever. Like, does the provider organization do enough kind of reevaluating their knowledge and growth in their own coding? Because perhaps they've done this for years, but now this is a new day, you know, a new decade, perhaps, you know, they haven't done any training or any sort of, or not plugged into an organization like an AAPC or an HEMA to keep themselves up to date on what needs to be changed, not just for reimbursement purposes, but also just for the due diligence of communicating accurately what's going on with the patient. You know, I love talking about, and you know, we'll do a separate video on this topic, 'cause I'm sure you probably have a similar perspective, but a lot of providers, they go the quick route. They want to send on the claim, or the organization wants to send on the claim just enough to get paid, but the claim itself, it's telling a story. That's the purpose of the coding, is the coder should be able to place that information on the claim so that it really tells the story to the insurance company. And we spend so many years of not having the technology at the insurance companies for it to understand that story well. So I think a lot of people started relying on, well, if they need more information, they'll just request medical notes. Well, that's not happening anymore. In this day and age, the organization or the insurance company wants the provider or the practice and organization to send the narrative in the claim, because their software is now intelligent enough to be able to decipher, okay, this is the frequency of, you know, this is the second or the recurrence of this particular condition, and here's what the provider did, and here's what they are, you know, recommending for the patient in the future. There's all this information that can be communicated on a claim form now, and I think it's beautiful, as long as you as an organization or provider are taking that into consideration to really make sure that everyone on your team is staying aware of how to use the codes to your advantage. Because you know, we tell a lot of our providers that, you know, if you use your claim properly and you code it properly, you can really prevent the possibility of an insurance carrier coming back and requesting medical notes, or the possibility of then going back and getting audited by that organization in the future. Because if they start to question, you know, this automatic coding that you or your staff is doing, and they're just picking out these kind of like what they think to be the best reimbursing codes for services that they're providing, without really trying to tell that particular patient's story, their unique story, then they see it. The insurance company software, they see all of these trends. They have all of this great analytical software, and they say, 75% of that organization's codes are the same for all these patients, yet one is 25 and the other one is 85. You know, there's looking at the variance in the ages of, and the one is a female and one's a male. That's so odd that we would see all this exact same consistency in the coding. So they're paying attention, and so it's really important that you start to, you know, I said we were going to talk about this later, but I love this topic because it's so many people miss the mark on it, and especially the way that technology has moved us so far forward. You have to make sure your people are trained. You have to make sure that they're staying up to date, and at the very least, like plugged into the coding organization, maybe that they have their certification, because there's all kinds of resources and groups out there that they can be a part of, even if they aren't necessarily, you know, kind of on their own earnest without getting just their necessary CEUs. If they're not just going out to get and they're not doing anything above that, they can at least be plugged into when someone announces, oh, did you notice this change is occurring or that change is occurring? They can really be a part of the conversation that people are having about those changes.
Right.
Yeah.
Right. And believe me, the continuing education that's required for each of our certifications in coding is no jokes. The CPC is 40 hours every 2 years.
That's great.
So it makes you stay.
Right.
And if you hold multiple, 40 hours for my CPC, my CCS is 30 more hours, my RHIA, you know, and so it's adding up. I spend a lot of time in continuing education.
Yes, and you know what? It makes it easy. When it's required, it takes the thought out of your mind, because it's almost like, I say this like for the state inspections on a car. Like if it's required for you to get your car registration done or whatever, then it means you're going to be looking at what's happening with your car on a regular basis without you even thinking about it, right? It's the same concept. It's like if they're making that a requirement, for safety or whatever the inspection is, then you are now you're abiding by the rules, and you're going to just keep yourself educated because it's a requirement, to have those CEUs without even thinking that, oh wow, I'm plugged in. I know what I'm talking about. Right.
Yeah.
Great.